FORA.tv. The world is thinking.
The American healthcare system didn't come to be this way by accident. It is the result of choices made and choices not made, of America's historic faith in individualism and antipathy for the state, of that strange brew of optimism and skepticism that makes us unique in the developed world. This is the other story I tell in Sick, the one I hope that will move us from anger and sympathy, maybe finally to action. The origins of the American health insurance system date back to the late 1920s and 1930s, which is really the first time that American healthcare became sophisticated enough that it was worth charging money for. And that was a great thing. We developed cures. Hospitals began to learn to do operations and surgeries. For the first time, you could go to the doctor and actually get better. But of course, there was one downside to all these medical advances. They cost money. And in the late 1920s and early 1930s, a group of foundations established what was called the Committee on the Costs of Medical Care to take what was really the first national survey of medical spending in this country. And it quickly became apparent two things. The first was that lots of people were suffering, that people suddenly couldn't literally afford to be sick. A week in the hospital was worth a month's salary to the average American. But there was a bright side to all of this, that only a few people at any one time were in this situation. Medical expenses were concentrated among a very small group of people. And if you could just find a way to get everybody to pay into a pool, to get healthy people to contribute with the knowledge that maybe someday they might be the ones who needed the financial assistance, you could create an insurance system and take care of everybody. Well, that was great, but of course, that raised another question. What kind of insurance system to have? Now, in the 1930s, we had a new president who had a new political spirit, and we know from the history books that Franklin Roosevelt thought hard about adding national health insurance to the Social Security Act. But he was worried. He was a politician, and he really cared about getting the Social Security Act passed. And his advisors told him that if he included health insurance as part of Social Security, state medical societies would rise up against him, and not only would they block national health insurance, they might derail the entire Social Security Act. So FDR ditched national health insurance, and that was a faithful decision because it turned out patients weren't the only people suffering with medical bills. Hospitals were too. In the 20s, they'd expanded, they'd built all these new facilities, taking advantage of all this new technology, and now their wards were full of patients who couldn't pay their bills. And if the patients couldn't pay the bills, well, eventually neither could the hospitals. So they needed a way to come up to pay with their bills. They needed a way to stay financially afloat, and they were the ones who invented modern health insurance. It started in Dallas, Texas at the Baylor Hospital when the new superintendent there who had worked at the Dallas schools approached the Dallas schools and went to the teachers and said, if each of you contribute a small amount every week or every month, we will provide 14 days of medical coverage. And that was the first health insurance plan as we know it today. These plans proliferated, and eventually the proprietor of a plan in Minnesota thought it would be a neat idea on his advertising poster to illustrate his new insurance plan with a blue cross. And that's how we got the Blue Cross system. The Blue Cross system actually operated a little bit like what you would call a social insurance system. After all, it was designed for the benefit of the hospitals. They wanted as many paying patients as possible. So they started by approaching large businesses. That way they knew they could get a large group of people and healthy people. There would be enough healthy people paying into the pool to cover the cost of those few that were sick. But they also had a pretty open door policy to individuals. If you came to Blue Cross and you had the money to pay for one of their plans, they'd give it to you. And they didn't ask whether you'd recently had cancer or whether you were at risk for a heart attack. Again, their goal was to insure as many people as possible. And so, over time, this system evolved. There were a few tax breaks that helped it along the way, wage and price controls in World War II, and before you knew it, we had what we have today, a system of private health insurance based on employment. It was assumed that the majority of working Americans would get their health insurance from their jobs. And from the 1920s up through the 1970s, this system worked well, or as I like to say, it worked well enough for enough people that efforts to dismantle it failed. And at a time when medical care was relatively cheap, employers liked this arrangement because it was a nice, easy way to buy worker loyalty. And unions and workers liked this arrangement because at a time when you stayed in the same job for your whole life, it was a reliable way to get health benefits. And even people who weren't employed were okay with the system because, as I said, the early insurance plans had pretty much an open door policy. Of course, there were always those left out of the system, the poor, the elderly, but we even managed to fix those problems, sort of, in the 1960s when we created Medicare and Medicaid. And so you ended up in a situation by the 1970s where 90% of the population had health insurance. It wasn't perfect, but it had gotten a lot better than where it started. And it wasn't perhaps unreasonable to think that it would keep getting better. Only then the economy changed. unions became weaker. Employers suddenly felt squeezed by competition abroad and competition at home. And this all happened at the same time that medical care suddenly got a lot more expensive. And if up through the 1970s all the incentives were in place to load up and to give employees good, generous health benefits, starting in the 1970s the incentives reversed. And I think the best illustration of this is if you think of the model corporation of the 1950s as General Motors, which eagerly loaded up its employees with very generous health benefits. Well, what's the model employer today? It's Walmart, which tries very hard not to give its employees good health insurance. And of course, when you have Walmart not giving its employees good health insurance, well, then all the other companies feel pressured to do the same thing. And that is a big reason why employers suddenly find themselves under all this pressure, and you see employers slowly getting out of the business of providing health insurance.